of databases, population demographics, healthcare infrastructure by state, and COVID-19 trends across major global regions and India. It is all based on ICMR data. In other words, we have only used published government data. We then teamed up with Protiviti, a leading consultancy firm with data science capabilities. Now, Protiviti scientists have applied sophisticated tools and, viewers, different projection models, as many as 6, to give us what we believe is a sophisticated prediction model which now is ready to use. As a first output, we have churned out a detailed national and major state city report on how and when the pandemic will grow, peak, and fade. We have also done this modeling according to state and, of course, the nation. Let me introduce you to our lead author of the report, who will talk a little bit about the methodology. Dhruvo Ghosh, or Dhruvo as we call him, is with us. I want you to first, Dhruvo, go over this methodology. Now, I'll read out what is on air, viewers, so you get a comprehensive assessment of what we've done. Before I bring in Dhruvo, the study includes a national analysis of 8 states and 3 hotspots. Very, very important. It assumes a 45-day total lockdown period from March 24th, 2020 to May 8th, 2020. So what we are saying is, viewers, that we are not taking into account what happens after the 20th of April as India heads into a graded lockdown. This projection is based on the fact that the lockdown is total. 3 models, the percentage model, time series model, and the SIR model, to make projections. That's what we have done. We've used these to make the projections. Estimate reproduction number for India is 2.25 with 95% confidence interval. Different states have different reproduction numbers. A day-by-day data based on state government bulletins, central government data, and daily updates have been used, viewers, to collate this study. For now, however, we will not be considering the percentage projection. We've kept that aside. So we are going to base this on 6 basic projections based on the time series and the SIR model to make the projection. Now I'm going to bring in Dhruvo Ghosh. Dhruvo Ghosh, what really are the time series model and the SIR model? What are they? Explain to our viewers before I start, of course, updating you, viewers, on the big figures of the study. Now, we're having a few problems connecting to Dhruvo. Let's get him on the telephone. Let's get him on the telephone. If you're having a problem, connect to him. Let's go straight across. Let's go straight across. We're connecting to him on the telephone. Let's hope he picks it up. But I just want to tell you, viewers, it's a day-by-day data based on state government bulletins, central government data, and daily data that is uploaded by the ministry. So we are not going out of bounds. We are not picking up data from any unverified source. This is data that is official. Every projection is made on that particular data. Dhruvo, I want to bring you in on this. You're the lead author of the study. What are the time series models and what is the SIR model?
Right. So can you hear me?
Yes, go ahead. We are listening to you.
So what we have done is we have done different kinds of modeling over the past few days. What we have done is we have looked at time series model. Now, time series model looks at kind of putting a polynomial regression on top of your database, and the polynomial regressions can be of different orders at the same time. So depending on whether it's a second-order polynomial or a third-order polynomial gives us the accuracy to which we can predict the information. Now, we have done time series modeling as one of the options, but what we understand that there are certain limitations of the time series modeling as well. A, it is kind of tries to overfit, and B, it also kinds of tries to keep on growing over a period of time, which means that there will be a very likely scenario that we will never see a peak and it starting to die down. That's why we thought that we should use something more different, like looking at SIR model, which is normally used for the purpose of pandemic modeling. It has been used previously for the purpose of H1N1. It has been used for the purpose of Ebola. So we use the SIR model. What is a SIR model effectively? It talks about breaking up the population into a susceptible population, an exposed population, an infected population, and looking at a recovered population as well. Now, we monitored the rate of change from one of these compartments, which is susceptible, to an exposed to an infected, and finally to a recovered population. Based on this movement and the reproduction number, we come up with a probability of a person being infected on a given day. Once we understand that, it becomes easy for us to plot these numbers. Now, does the SIR model also have a limitation? Yes, it does. It is a non-causal model, which means that we are not taking into account anything related to BCG vaccination. We are not talking about whether this is a less virulent strain or a more virulent strain. So we are keeping those causal factors out of this model. It looks at what is happening today. It is based on the data which is available as of April 15, and it tries to forecast what is going to happen for the next 15 or 30 days. There is another factor which it doesn't consider, is what if there is a second wave of infection which hits the market. And hence, this model, though very scientific, has a bit of its limitations as well. Hello?
Dhruvo, thanks indeed. Now just stay on with us, because we need to really be a little more lively, okay? And I'm going to now project the first big number, right? The first big number is, by when will corona cases peak in India? We're going to put that out for you. There are three projections, viewers, according to three dates and according to different models. Now, if India was following the same graph of transmission as Italy, as the United States, and of course as China and South Korea, our numbers would have looked very, very different. But what does it all mean when we look at the SIR model and the other two models in the extreme right of your screens? And if you take an average projection of these six, if you are following the Italy curve, the US curve, the China-South Korea curve, if you really look at the number thrown out by the SIR model, which is at 54,000 on 3rd May, which is when this particular lockdown, the second lockdown, is to end. And of course, the two other important models that we've used, we come to a number of 38,534. Now, as I told you, viewers, this means this number holds true in a definitive total lockdown till the 3rd of May. This is very different from the projection or from the statistics announced by the Health Ministry today, where they are saying, in fact, that there has been a degrowth, a significant degrowth in cases in India, and we, in fact, might actually be breaking the back of corona. In fact, the Health Ministry official Love Agarwal said there's been a 40% decline in growth factor of coronavirus cases. So Dhruvo, if that were the case, then this average number that we have taken of these projections is vastly off, because we are only at around, at this moment, 13,000 odd cases. So this is completely off the charts. How do you explain this, Dhruvo?
Right. So we believe that when you're looking at a sale model, right, what we have observed over the last 5 days is also a downward trend. The reason being, most of the states in the southern part of India have started showing more recovery than actual number of cases getting reported. However, if we overlay the other states, there is still an upward trend. And we believe that the sale model still holds good when you look at India as an overall. This is only decreasing because we are taking a law of average. However, on the other part, if we look at India as a whole, there will be a spike, and we expect that by 3rd of May, we will be somewhere around 54,000 if we go by the sale model. Even if we go by the polynomial regression, which gives us a 98% accuracy, we would be around 34 or 35,000. So we believe that 38,000 is something which we are looking at 3rd of May.
What is the R0 that you have put to this? What is the rate of transmission, in other words, that you are pegging all this to, Dhruvo?
The rate of reproduction is pegged to around 2.25.
Isn't that on the higher side, Dhruvo?
We don't believe, right? 2.25 is it's within a confidence interval which starts from around 2.1 to 2.9 on the higher side. We have assumed the 2.25 based on the research and based on the simulations that we had run over the last, I would say, 20-25 days. And we have seen that 2.25 is the right number to look at India right now. But if you go by states, it's a different number. Some of the states is as low as 1.2, and some of the states are as high as 5.2 as well. So it's a mixed bag. It's not one size which fits all, but India overall is roughly around 2.25.
Okay. Let me bring in Dr. Trehan first. Dr. Trehan, this projection assumes that the corona cases will peak, if you look at the dateline, on the 3rd of May, and we will have about 38,534 cases. That's quite a significant number. That's almost thrice the number that we have today. Do you think that this is a possible scenario?
See, Rahul, these rules can be extrapolated to statistical analysis and some areas from what happened in other countries as we move forward. The basic facts are that we need to look at the trends that are trailing down because of the fact that we, with the incremental testing which is happening now, the number of cases on a 3-day trailing pattern are actually reducing. It gives us some comfort. But also we must understand that we are talking about a total lockdown at this point. Now the real test will come when we start opening up on the 20th, when we incrementally allow some of the areas to start functioning again and large number of people will start interacting. Now that's the main concern here, because this statistically it gives us two facts. One fact is that, okay, India, are you prepared? How prepared are you? Don't let down your guard. So that is one fact. The other is the joy of the fact that we have been able to flatten or even bring a downward curve So if you ask me, we are somewhere in between, and we actually will have a major challenge, because how are we going to allow large number of people to congregate in industrial units, on the streets? So how much of the social distancing and masking and discipline people show? Because there are areas, and I'm watching on your channel also, where people are still breaking out and going out in the marketplace like it was normal. So if it will be the responsibility of the citizen that will determine what the curve will look like, we can actually do all the extrapolation we want, mathematical models that we want, but that biggest variable is behavior pattern of the population.
Okay, behavior pattern are very, very important words from Dr. Trehan. Remember, viewers, that in just about 3 days, we are going to be relaxing some of those restrictions and curbs that have been imposed all across this country. We are going to do it systematically. We are told we've already divided various zones into different colored zones. Some are green, some are white, some are orange, some are red. And in those areas, which are of course not red zones, we're going to allow certain activity. But that is not a free pass to break social distancing norms completely. Whether you're in a big industry, whether you're in an office, in a bank, in a practice somewhere, you have to still maintain those social distancing norms. Otherwise, the R0 that we have struggled so hard to bring down to about 1.3 today will go up. And that particular curve that has been plotted by the Times Fact team and Protivity will perhaps be realized. Now let's look at what happens if we project a few more days onwards, May 14th. Well, we will have 65,000 cases tabulated as an average of about 6 projections. So if you just move on, Nizam Bhai, and take projection 2 for 14th May, we will see that the peak will begin to go slightly further up. And once again, it's the SEER model that is really going very high. It is projecting almost 2 lakh cases by May 14th. Remember that the projection is once again based on a total lockdown, which will not be the case post 20th of April. And I want to bring in Dr. Shamika Ravi also on this, as well as Professor D. Prabhakaran. First of all, Dr. Ravi, your thoughts on this second projection of 14th May, if that is, of course, we were to extend the lockdown by a few more days to keep it total right up till the 3rd and not loosen the restrictions on the 20th, then even by the 14th of May, we are having a big projection like this of 65,000 confirmed cases.
Yeah. Well, Rahul, it's important to realize that the numbers that we are seeing today, so we have been using simple statistical models to really fit the existing numbers. And if you look at the 5-day moving averages, right now we are in a situation where we are doubling our active cases every 8 days. Okay, it's important to realize that the numbers you are seeing today are an outcome of actions we might have taken 2 weeks back, right? 10 days to 2 weeks back, because that is the nature of the virus. That's the incubation period. Now, this is really an unfolding situation. At the national level, the projections, it would be a bit simplistic to keep all current factors constant, because you see what has happened across different states. And this is where I think now the time is right for us to now take these analyses at the state level, because all of India, we're talking about national lockdown, and yet the severity of this infection is very different in different states, right? Even now at a national level, we know that it's basically 170 districts, which are hotspot districts, right? We know that there are close to 325 districts which are currently COVID-free. So now, when we talk about these national projections, it's not really helping in terms of the calibrated lifting of the lockdown, the conversation we should be having, because that is bound to happen at a localized level. The economic activities are going to go back to normal at a localized level. So I think, I agree with the projection. In fact, the 33, when I joined your talk, I heard the author put up a projection as of 3rd of May of around 38,000. Yes, that seems absolutely reasonable if you consider the current growth rate. But I'm expecting the current growth rate to also go down further.
Okay, on what are you basing this? Let's have that conversation. On what are you basing the growth rate to come down? Because we know that in about 3 days, we're going to be lifting some of the curbs.
Well, given that we are noticing today the growth rate, which is an outcome of policies and human behaviors from 2 weeks back, right? And over the last 3 days, we have gone from doubling every 6 days to 7 to now doubling every 8 days around. So this is a dynamic situation. If you're, instead of using a SEER model, if we just look at statistical projections of what is the current growth and try to take that forward, I suspect by May 3rd, this is going to go down further. And I think we need to do this analysis now at a highly disaggregated, localized level, rather than talk of national lockdowns, whether lifting or continuing at a national level.
Okay. Is that a limitation, Dhruvo, in the study? Is there a limitation in the study before I bring in another number of 8th May? Is that a limitation?
See, these are non-causal models. So, yes, I agree that it cannot take into effect the lockdown. However, if you look at the last 20 or 25 days, India has been in lockdown. We are basing the data or the projection based on the last 20 days. Though it's a non-causal model, but it still takes into account those numbers which has been reported on a day-to-day basis. There is one more thing which I agree. If you have looked at the last 2 reports, our projections have also gone down, because we are looking at the projection every 4 days to see how it changes over a period of time. And definitely there has been a downward trend, as I was saying earlier. And another 4 days down the line, perhaps it will either go down or go up, depending on how the social distancing is maintained post the 20th April lifting of the sanctions to a certain extent.
Okay, that's interesting. Now, I want us to focus on the 8th of May, which is between these 2 time periods. Remember, May 3 is till when this second lockdown of 20 days has been put into place. We are going to have some relaxations in precisely 3 days, viewers, but those are contingent upon us observing social distancing norms. Prime Minister Modi has made it very clear that if you defy those norms, then certain areas where the lockdown was lifted will go back into lockdown. So he is expecting us to maintain social distancing. But the fact of the matter is, on the 3rd of May, we will have not an unreasonable number, Dr. Shamika Ravi says, 38,534 cases, if this projection based on an average of 6 models is right, including the polyregression 2nd degree and the polyregression 3rd degree model that we have chosen. Now, let's look at the 18th of May. 18th of May is interesting because it's between the 2 periods, that the 3rd of May and the 14th of May. So projection number 2 is what we have to look at, the 8th May projection, which is at 46,819. Now that is another average. And I want to come out to Professor D. Prabhakaran, Vice President, Director, Center of Control of Chronic Conditions, PHFI. I want to bring you in on this. Dr. Prabhakaran, Professor Prabhakaran, what do you make of this projection that we've put out for the 8th of May and for the overall projection that we've done for the 3rd and the 14th?
Thank you, Rahul, for asking me to comment on this. And first of all, I would like to congratulate the team on the analysis, because I think they've used 3 different approaches for the analysis, and it's quite sophisticated. But at this point of time, before getting into the actual numbers, we need to understand that there are several limitations to modeling. I mean, this is not necessarily your modeling, but in general, modeling has certain limitations, particularly in a disease like COVID. The reason is because there are several several moving parts in this picture, and it is so dynamic and fluid that things change within 1 or 2 days, and we don't take into account those changes when we do the calculations. Irrespective of the numbers that you're putting out, I mean 45,000, 60,000, whatever, those numbers are within the realm of what we would like to do. And the reason why the numbers are going up, we should not forget, is because we have relaxed our testing strategy. When you relax the testing strategy, when you increase the testing, the numbers go up. And what's more important for us is to actually look at the number of deaths, as the number of deaths concurrently gone up with the increase in the number of cases, which it doesn't appear to be so. And we should also look at the good news in terms of the doubling rate, which has actually gone up to 8 days now, which is an exceedingly good news for us. The reason for all, I mean, what the lockdown has actually done is, I mean, the whole idea was to break the cycle, but beyond, more immediate than breaking the, the transmission cycle, is it is actually doing what is called as flattening or fattening of the curve. Normally, when you don't do anything, when you just leave it like that, your number of cases will just rapidly increase, and then it will reach a certain peak, and then it will, Maharashtra, for example, or Tamil Nadu, actually, which is becoming better now. So there are hotspots, Indore, for example. These are the places where you really require multiple ways of modeling and interventional approaches tailored to the needs of each of these states. That would be my take.
Well, that's very, very interesting. Very, very interesting. And obviously, in just a little while, we were going to do the state-wise projection also. But there is another date, the 22nd of May. And the 22nd of May is important because we're also going to be firing the takeaways in the grid in just a few moments, as well as, of course, on air. But look at the 22nd of May projection. So as we are going further, viewers, the number of cases are rising, 76,349 to be exact, if you look at the average of against the 6 tabulations. Of course, we are nowhere near where the United States or Italy is, even on that particular date. But the fact of the matter is, these are all dynamic. These are all dynamic and they keep changing. I want to go back once again to our panel and bring in Dr. Sitabra Sinha. Now, Dr. Sinha, you've been one of those who has said that India is beginning to flatten the curve. How does our modeling exercise strike you, given the fact that you have done your own modeling and you seem to have a slightly different take on this?
Well, on the numbers that are projected at the national level, even though I'm using a different model, I would agree. So, for example, based upon our own models, we are estimating that by 20th of April, we'd have about 18,000 active cases all over India. And it's not a stretch of imagination to think that by early May, we'll have about 30,000 active cases. So on that point, we certainly agree, even though our estimation of the effective reproduction number is quite different from what your team has come up with. Where I think we differ is at the level of the states, which is probably not surprising because statistical techniques need large amounts of data to become more accurate. And when we go down to the level of states, the amount of data is actually less because we are actually looking at fewer cases compared to the country as a whole. So, for example, I see that the projections that are given by your team for Tamil Nadu essentially says that things would appear much more dire than they are actually. So, in fact, our analysis shows that the rate of growth for Tamil Nadu is in fact not even exponential, it's actually linear. So that means it's on a much slower growth trend than what you expect from an epidemic. It could reflect the success of containment. It could be, some other artifact that we don't know about.
So let me just ask you, at a macro level, do you believe that the lockdown, and even after the 20th, for example, when certain restrictions are lifted, that trajectory that R0 will continue in the same direction that it is right now, which is slightly on the lower side, and of course seems to be flattening out? Do you believe that, or do you think that all of that will go out of the window?
Well, certainly if the lockdown is relaxed, I would expect that there would be increase in the like reduced growth rate that we are seeing at the moment. So, currently it has reduced from about 1.83 to about 1.53. But we would see this effect only, after a gap of about 2 weeks. One of the experts in the panel earlier mentioned that, what we are seeing is always with a delay of about, a couple of weeks, because, that's the time it takes for a person infected to eventually come up with symptoms. So we would probably see this 2 weeks following the relaxation. That's, somewhere around early May, we should expect to see probably increased rate of growth. But it's very hard at this point of time to exactly predict by how much it would grow.
Okay, but Dhruvo, you're postulating that after May 22nd, there could be a reduction in the rate. How have you come to that conclusion?
So what we have done is, as he was mentioning, R0 is also a factor of time. So as we progress, we are also expect that R0 to reduce. What we have done post 15th of May is we have done certain scenario analysis. So we have assumed, because of the lockdown, what if the R0 goes to 2 or 1.8 or 1.6 or 0.8. And accordingly, we have done further analysis on where India would be 30 days from that particular point, which is 22nd of May. And that analysis has also been published as part of the report to see whether, if we are not able to tackle R0 on 22nd of May, we perhaps are looking for a much higher exponential peak than perhaps the 286,000. However, if we are able to control the R0 to a 0.8 or a 1, perhaps we are looking at a decay function and finally getting rid of the pandemic from India.
Okay, so that's very important. Dr. Bagai, controlling R0 is critical. How, as a medical practitioner, do you think that's going to happen?
Good evening, everyone. I think the data predictive analysis is a very useful tool because it gives you a bandwidth as a projection, as a set point, so that you know where you're perhaps going and where you can curve your ship towards safety. But all these projections actually have a lot of non-tangible factors which are almost impossible to factor in, like social behavior. The viremia load. Now, there's a recent study which is published on 6th of April in Lancet, which shows that the super carriers, especially in the hospital setting, can spread from 6 patients onwards and a multiplication factor of 6. So the dynamics of numbers change. We also cannot factor in the age and the comorbid conditions in the hotspots. And lastly, most importantly, very, very critical point is this study is not factoring in the ELISA rapid test. So it's not a true projection of the numbers till you don't have a ELISA test, because we don't have the complete 3 set of cohorts to give you the total T number. But having said that, this is a kind of projection with regards what's going to happen after 20th of April and then 3rd of May. Much will depend upon how we behave, and much is going to depend upon how quickly we can contain the hot zones. This is something which is beyond government control.
But I just want to look at some of the top line averages, and I want to bring in Dr. Shamika Ravi as well as Dr. Bagai on this very quickly before I introduce to the panel Thomas Isaac, prominent economist and finance minister of Kerala, who's done a fantastic job in limiting the spread of COVID in the state. I'll be just coming out to you, sir. Bear with me. Shamika Ravi, I just want to ask you this, doctor. Based on the numbers we are seeing, if the basic assumption was that we were trying to stall the progress of COVID-19, through the community, I think one could fairly say that the lockdowns coming as early as they have, extending over 41 days, will have actually done that. So our medical system will be able to cope with this kind of caseload. Would you agree?
Rahul, I'll tell you some things we have to clarify to ourselves and to all the viewers. Number one, all these epi models that we have are making assumptions on parameters which are really just assumptions. I mean, we are talking about what is your belief about R naught.
Of course.
It should not be a matter of belief. There are contact tracing, for instance. These are parameters that should be estimated from the population. Why are we reading tea leaves? We are just picking up parameters from the epi models from the OECD countries, from the Diamond Princess cruise ship, from China, and we are fitting them to our model. That is number one. And that is really making this whole exercise quite useless, all right, just broadly. Number one. Number two, a lot of these models don't take into account the fact that human behavior is very dynamic. Just because the lockdown will be lifted doesn't mean we'll go about shaking hands. Most of us will wear masks. There's something called elasticity of demand for self-protection. People will protect themselves. Institutions will come up with measures. That's the dynamism in this model, which is completely missing. And therefore, we are not in a position to exactly estimate where this will end up, right? But to your question on, do you think the lockdown has had an effect? Absolutely, unequivocally. Now, maybe there are other factors as well. But if you just look at the statistical progression of the total number of cases and the new cases, which is a mark of the infection, we are seeing an inflection point on the 6th of April. Since when our doubling rate or the growth rate of these cases and active cases has been declining, systematically declining from the 6th of April. So I think lockdown has had an impact. Withdrawal of the lockdown will not automatically lead to a massive increase in R naughts because people they want to preserve themselves. People will take measures. Firms will take measures. Government institutions will take measures. It's right.
Yes. Yes, absolutely. But Dr. Bagai, just look at the caseloads that we are projecting. Even if you were to look at individuals and if you look at the statistics in different countries, where COVID has afflicted large number of people, we have seen that those that reach the critical stage are confined to about 1.5% maximum of the total infections. So even if you're looking at the 3rd May figure or even the 22nd May figure, that will be easily dealt with because we will have the contingencies in place. Very quickly, Dr. Bagai.
Yeah. Just two pertinent points. I think any data analytics as projections is valuable, but we shouldn't worship it because there are a lot of intangible factors which can never be factored into this kind of a dynamic evolving study. Now, if you just take 2 points in comparison with India versus Italy or India versus US, and those 2 points are their death rate versus the death rate, unfortunately, which we are still seeing in small numbers in India, and their patient density population versus our patient density population. We have unfortunately lost about 440 or 450 odd Indian citizens, and they have crossed 35,000. Their patient population density is 33 per square kilometer. We are crossing in slums 2,75,000 per square kilometer. It's an unequal playing field. Therefore, the lockdown has been the biggest masterstroke at the appropriate time, and I can't say this enough. If it was not for this, by any length of any calculation, by any method, our death rate would have been in many lakhs.
Yes. Okay. Let's quickly project the numbers for some states. Dr. Thomas Isaac is also here with us, prominent economist, Finance Minister of Kerala, special guest, and someone who deserves a big round of applause because Kerala has really shown what can be done. In fact, even the center is looking at now the Kerala model for a wider range of populace. So here is what the Kerala picture will look like. Let's just put out that. There you can see the Kerala picture now. If I were to extrapolate our projection for Kerala along 2 basic dates, The first date, of course, being May 3 and the second being May 14th. On May 3, we will have only 1501 infections. May 14th, only 1567 infections. So you can just see, even though 10 days will have passed, the number of infections would have barely increased. I mean, statistically, it's quite insignificant. So, Dr. Isaac, first of all, how did you achieve this? And can your model be replicated across the length and breadth of this country?
Why not? It can be done. If it can be done, one advantage we have a very robust public health system. Now, that cannot be replicated immediately. It's a historical legacy. But otherwise, the kind of intensive testing and tracing and quarantining and social distancing that has been pursued in Kerala very successfully, that can be replicated anywhere. Why not?
Okay. So what is it that the Kerala government did effectively in the very beginning, given the fact that you had a transient population coming from abroad, where there was, of course, maximum exposure?
Well, one, of preparedness. We were ready with our experience in Nipah outbreak in 2017. The moment we heard about the Wuhan outbreak, I knew that many of our Malayali students for medical studies would be coming back. We immediately had the control room in early March itself, and mock drills were conducted, protocols were drawn up, training was given, so much so that there was not a single spread, secondary spread from the Wuhan returnees. But then in March, things went out of hand because large number of people from Gulf and Europe came. And then the number of cases were almost doubling every 4 days. That's when, in fact, even for the national lockdown, we went to some very stringent measures. The most important was our, what we call the route map. Every positive patient,
Yes,
the route map for the last fortnight is prepared, and every person who has been in contact with him traced. And we used not just this testimony from the patient, but also like the mobile phones, the CCTV cameras, and so on. This was the big effort went into that. And then test everybody. And anybody positive, put them in the isolation ward, quarantine the others. So it went on. I think this played the most important role in containing the spread.
so introduce, I think we've just had a small problem with Dr. Isaac. I think we've just lost him there. There he is. Yes, there he is. I'll come back to Dr. Isaac because I want to ask you another question, another challenge that you might be facing in just a little bit of time. But I want to come back to that. I want to introduce to the panel Rajiv Kumar, Vice Chair of the Niti Aayog, who's here with us. And I just want to ask you, Mr. Kumar, the projections that we have done show that the single biggest factor in slowing down the advance of COVID has been the lockdown. And perhaps the stage is also set effectively for the graded lifting of the lockdown post the 20th. So yes, congratulations are in order, but the important thing is we have to up the monitoring so that we don't abandon the ways that we have got used to. It cannot be life is normal. There's a new normal and we have to exercise social distancing. That really must be your greatest challenge, right?
Absolutely. That is the greatest challenge, Rahul. And there is no way that we can at all get even a smallest degree of complacency in this. And after the 20th, as we open up, there will be a risk of the infection catching, spreading, etc. So we have to be even more cautious than before. But the graded opening up is also necessary to balance, the well-known issue now between livelihoods. So not just the 20th, but even after the 3rd, what you would get is still tracking, the quarantining, social distancing. The new normal will have to continue for well, right up to June, as far as I can make out, because this virus is not going to just disappear. This will remain with us, and what we have to do, I think this is where, if I get the name right, Dr. Malayali of the Vellore Christian College has wanted, we also have to give special attention to our senior citizens, those with comorbidity, because we have to protect. So that's where they are the most vulnerable. But the good point, good news, Rahul, is that two good news. One, that the average rate of infection world, the global average, is about 120 million. We are still at 10 per million. That's an amazing statistic that we've got, and we will remain there. The second one that we have is
Yes.
that we our own the rate at which our mortality is also, every mortality is very very sad, very avoidable, but that also is much lower than the rates in some of the other advanced countries. And I think this is where we shall have to continue to focus on it and keep those rates lower.
Following either the Kerala model, which has of course been an amazing example, for the rest of us, and now that the kits have arrived, etc., we will continue on that path post the 20th and even post the 3rd, as I said.
Okay, just stay on with me. I just want to quickly go through some of the other states and the numbers there. Karnataka on May 3rd would be around 847. We're going to put that out. Karnataka would be around 847. Again, on May 14th, that number will go up to 925. That's what we are projecting. I'll bring in Dhrubo on some of these projections in just about 3 minutes. Tamil Nadu, once again, Tamil Nadu, interesting number there, 2,709. And then on May 14th, it could go up to about 3,058. Obviously, different conditions obtained in different states. So you're going to see variations, viewers. Andhra Pradesh, 1,214 in on May 3rd. May 14th, we are estimating about 1,323 cases. Once again here in Andhra Pradesh and both Telangana, we are going to be seeing perhaps the state being able to curb the R0, so to speak. Tamil Nadu, 2,709. May 14, 3,058. In Telangana, 1,300 and 1,450. Maharashtra is going to be slightly troublesome. May 3, 9,551. But by May 14th, that number will go up to about 16,219. That's the analysis that has been done. Rajasthan, May 3rd, 4,236. May 14th, 11,578. Now, it's interesting to note that certain states which are seeing these spikes are the states which got hit by an event that no one had actually seen coming, which was also the movement of a large number of individuals who had attended the Markaz. And Delhi is a classic example of that. May 3rd, we expect the number of infected cases to be at about 5,878, and that number goes up in just about 10 days to 14,283. Dhrubo, just talk us through the numbers in Delhi, talk us through the numbers in Tamil Nadu, and of course in Karnataka and Maharashtra.
See, most of these numbers that we are talking about are based on an average of different models which we have used. And they are all dependent on the past data which we have seen. If you look at Karnataka, Kerala, Tamil Nadu, and Andhra Pradesh, you will see that the R0 has gone down significantly. And the one which I remember on the top of my hand is Kerala, which is at 1.2 or less right now. So we are definitely seeing a downward trend for them, and hence the rate of change in this is very, very less or very slightly changes which are happening. However, if you look at the states like Maharashtra and Delhi, there has been a growth over the past 1 week or 14 days, and the rate of growth which comes down into the SIR model makes them the hotspots, right? Even if you look at today, these are the states which are the hotspots in India: Maharashtra, Delhi, Rajasthan, and Uttar Pradesh. And the number of cases adding on a day-to-day basis is more than the rest of the states combined. And that's why this is what also is
Yes, Rajiv Kumar, you were raising your hand. You wanted to come in on this. Rajiv Kumar, yes,
Yeah,
go ahead,
I
sir.
did want to come in because I think the data is of April 11th as far as I remember. And the data, it does not take into consideration the additional 3 weeks of lockout that we've had now. Why I'm saying that is that it's all about R0.
Well, we, sir, updated the data
is within our hand now control.
Sir, we updated the data.
If we can maintain our norms, our protocol of social distancing, of tracking and testing, I think this R0, the high R0 in Delhi and in Maharashtra, etc., can also be brought down. Will in fact be brought down. So therefore, while these, so I do want to let the viewers know that these numbers can be lower than what they are being projected at the moment.
Sure. I mean, there's always that possibility. Look, no maths is no projection analysis, because you feed in assumptions on which you have, of course, a subjective opinion, can be exact. So let's first of all clarify that. We've never claimed that this is an exact study that is going to immediately give you a very, very accurate number. But Dhruvo, the study has been updated, hasn't it? We did share it a few days back with some of our panelists here for a peer review of sorts, but that was based on data collected till the 11th, but we have updated it very quickly, Dhruvo, yes.
Yes, so we updated the data based on 15th of April. So that has been taken into account.
15th of April. So it is the closest approximate data that we can actually furnish from official sources. Very quickly, Mr. Isaac, I want to come out to you, Doctor. Last comment. There is going to be a bit of a challenge because there are about 2.5 lakh state citizens or denizens or domiciles who are working in the Middle East, and they might be returning at some point. Now that will present a second channel, wouldn't it, sir?
Right. It's not 2.5 lakh, more than 20 lakh. It's a large number.
20 lakh.
And many of them do want to come back to Kerala. Therefore, the immediate impact of withdrawal of lockdown is going to be large number of them are going to re-enter the state. And we are prepared to the extent possible. We have now identified 2.5 lakh accommodation beds in hostels, private buildings, say private hospitals, and so on. So we are preparing for that eventuality. And another thing that we may
best of luck. And your model has really worked wonders, and many states are going to adopt it. The center has championed it. This is a completely a very, very welcome endorsement because it is completely bipartisan, viewers. And this is what India needs. More bipartisanship. All of us have to fight COVID. We have just given certain indications of where things could be for the government also to consider. We are not trying to influence any of the numbers, any of the projections. We're not trying to suggest here that this is all very statistically accurate. These are based on assumptions that are fed into a model to give you a number. It could all change. Human behavior is very different. And so, of course, is the behavior of a virus. We leave it at that. We continue in the next half. Coming up, when is the ideal time to lift the lockdown? That's the big question.
Stay home and get your car insurance online at acco.com. Takes just 2 minutes with low premiums and zero paperwork. Check acco.com. Stay home, stay safe.
Beat sensitivity fast with Sensodyne Rapid Relief. Works in 60 seconds.
कैंट के नेक्स्ट जेन आरओ में जरूरी मिनरल्स बने रहते हैं
और मिलता है डिजिटल डिस्प्ले प्योरिटी का।
तो आप कैंट का नेक्स्ट जेन डिजिटल आरओ कब ला रहे हैं?
I like it.
इतना स्लो, मैच तो गया। डैड, आपने ये वाला सुना है? I care. Watch this. And this one?
I love it!
I got this.
Spotify के 50 मिलियन सॉन्ग्स के साथ डैड को रोज नया म्यूजिक सुना? Spotify सुनते जा। डाउनलोड द म्यूजिक ऐप फॉर फ्री।
जिसको पीते ही ऐसा लगता है जैसे
जन्नत, जिंदगी,
sublime, fresh,
awesome, संतुलित,
बहुत मस्त यार। पैकेट से कैसे भी?
अमूल मस्ती बटरमिल्क, देसी रिफ्रेशर।
Care salutes the brave COVID warriors.
When I wanted to take a life insurance policy, I visited the LIC website. It's so user-friendly. You can choose a policy, make a premium payment, and do a lot more. Why go anywhere else?
Introducing ET Prime by the Economic Times, a premium experience with exclusive stories for leaders of tomorrow.
Care salutes the brave COVID warriors.
आजकल सब कुछ सुपर फास्ट हो गया है, यहाँ तक कि LIC की पॉलिसीज का प्रीमियम भरना भी। बस LIC की वेबसाइट पर जाकर फटाफट प्रीमियम भर देता हूँ, समय की भी बचत और नो झंझट। तो फिर मैं और कहीं क्यों जाऊँ?
Stay home and get your car insurance online at acco.com. Takes just 2 minutes with low premiums and zero paperwork. Check acco.com. Stay home, stay safe.
डैड, आपके जमाने का गाना।
मेरे जमाने का गाना। 50 मिलियन सॉन्ग्स के साथ डैड को दोस्त बना। Spotify सुनते जा। डाउनलोड द म्यूजिक ऐप फॉर फ्री।
Checked out the LIC website. Solid info, user friendly, and very today. I'm sure they'll keep pace with me. I'm going for LIC.
Sharp business insights to help you navigate your industry. Deep data-driven analysis that reveal the right business levers. Let the experts guide you to move faster than the competition to the top. Introducing ET Prime by the Economic Times, a premium experience with exclusive stories for leaders of tomorrow.
Namaskar. COVID. Panicking does not help. Prevention does. Lockdown extended means We did not adequately follow safe distancing. We did not adequately understand hand wash, and we have not masked ourselves adequately. Thyrocare appreciates and salutes doctors, nurses, technicians, and police for their commitments and sacrifice.
Good evening, ladies and gentlemen. Welcome to this special broadcast of Times Fact, India Outbreak Report. We are going to give you projections of how we have seen these infections and at what time will they peak nationally for every state, the 8 states that we've considered. And we will also tell you in this broadcast over the next 1 hour the report of the 6 major metros, and we will look down at which is the best lockdown period for us so that it helps us actually space out and plan according to the infection rate as it is behaving in different parts of the country and what's the ideal lockdown period. All of that coming up on the next 60 minutes of this Times Fact broadcast, because we here at Times Now believe that you can fight fear with facts, and that also is the hashtag of our broadcast, Fight Fear with Facts, and this is the India Outbreak Report. The current pandemic crisis is probably the most significant event of our lifetime. At the onset of the pandemic in India around mid-March, and even before the lockdown was announced, we realized that data on the pandemic outbreak will be a critical asset for us to understand. It's a critical asset not only because it helps us assess the consequences of the pandemic, but it also helps us assess and plan of how to look at the infection rate, how it's going across from state to state, from city to city, and what are the ideal lockdown periods that will be important to control the spread of this pandemic so that our health services as well as our businesses can plan for this much better. We at first looked at the output and churned out a detailed national and major state and city report on how and when the pandemic will grow, peak, and then begin to come down and finally fade. We've taken a look at a lot of models. These models on which we based our entire projection have followed a certain methodology. Times Now, along with Protivity, has worked on this methodology. And this study includes a national analysis of 8 states and 3 hotspots. It assumes a 45-day lockdown from March 24th to 8th of May 2020. It also looks at 3 models: the percentage model, the time series, and the SEER model. Sorry. Let me get in Dhruva Bose of Protivity to tell us what exactly are the assumptions that we've made while driving home these models and looking at the projections that they're putting out. Dhruva, over to you. Can you explain to our viewers how we've modeled based on these 3 models, looking at projections for the ideal time period of the lockdown?
So these 3 models are very different in nature. The first set of models you talked about are percentage-based models. It's very simple. We look at what has been the percentage change in Italy or US or South Korea, and we say, what if India follows that particular path? But very unlikely that India would follow a percentage-based model based on other European countries. So we next tried out what is known as the time series model. In a time series model, we are looking at what has been the past data point, and accordingly, if we extrapolate based on time, where we would be at the end of a certain period. However, it is also not the best one to do a pandemic forecasting. So we moved on to what is known as a SEER model, And as we were explaining in the last hour, still takes into account or breaks down the entire population into who are susceptible, who are exposed, who are infected, and who has recovered, and how they are moving from one compartment or one bucket to the other. What we have assumed or we could not put in the model presently is if there are certain causal factors. Causal factors can be obesity vaccination. An obesity vaccination or for that matter, let's say, if the virus has taken or mutated in a less virulent or a more virulent strain. So these are causal factors which we have not been able to factor in. What we have also assumed that there will not be a second wave of infection. We have assumed that this pandemic...
So, Dhruva Ghosh, we are also, it's important to put out at this point that we are looking at only government data. We are looking at the updates that have been given by various state governments. We are looking at the ICMR and the Health Ministry data that have been put out in the public domain. And we've based our projections based on these 6 averages that we have. And these 6 averages are based on the 3 modeling studies, the time series, the percentage series, as well as the SEER, which is actually the susceptibility, exposure and infection rate study. First, let's look at the national picture. And ladies and gentlemen, I'd just like to recap the national picture for you through these graphs. If there is going to be a peaking lift up of the lockdown on May 30th, in fact May 3rd, the total number of cases in our country will be in the region of 38,534. On May 8th, these forecasts show that this figure will go out to about 46,819, which will be the total number of positive COVID cases in the country. It could escalate to about 65,601 cases by May 14th, and on May 22nd, this could touch a peak of 76,000 on May 22nd. That's the national picture that we are giving to you. But based on these projections, we also have a complete hypothesis based on projection of these numbers on how an ideal lockdown extension could actually help control these numbers, bring down the peaks, and also bring down the time period in which we will be able to actually nullify this COVID infection and pandemic across the country. So let's take a look now at the projections that we are looking at for the first lockdown and how long this lockdown should last. In scenario 1, we are looking at a lockdown till May 15th, ladies and gentlemen, with an RO of about 0.8%. It starts from 69,459 cases on May 15th and becomes 0 by September 15th. So if we lift up our lockdown by 15th of May, we will be able to sort out our problems and come to a 0 COVID positive case in the country by September 15th. However, in scenario 2, if we were to extend the lockdown by just another 15 days up to 30th of May, with an RNO of about 0.8, this means it will begin at 79,230 and become 0 by mid-June. So look at the value, look at the plus points in an extended lockdown, and the extended lockdown actually shows that by mid-June we will be able to be a corona negative country. We will have no positive cases of corona by the 15th of June if we were to extend the lockdown till the 30th of May. Is that a good price to pay? Because everything comes with an economic cost. So let's get in our guests at this point in time. We are joined by Dr. Bagai. He's the chairman of Nephron. We also have Dr. Devi Shetty joining us on this show. Also joining us is Dr. Anand Ranganathan, author and scientist, and of course Sanjeev Sanyal, who's going to be joining us in just a bit. But first, let me just go across to Dr. Devi Shetty. He studied these numbers. He's given his projections. Okay, Dr. Devi Shetty is just about to join us. So, Dr. Anand Ranganathan, let me ask you first. Lockdown definitely has been showing results in the control we've had on the number of cases. I want to ask you, Dr. Anand Ranganathan, at this point in time, whether an extended lockdown beyond the 3rd of May, for which we are currently waiting, if it goes on till 15th of May, we will be COVID-free by 15th of September, but if we extend it to 30th of May, we will be COVID-free by mid of June. Do you think this is a price a country like India can actually pay at this time? Because every extension of lockdown will come with an economic cost. Where do you stand on this?
Yeah, thanks very much, Navika. No, actually, I don't think we can pay this price. But first of all, I want to congratulate you and Dhruvo and the entire team for these excellent models and projections. I especially liked RO assumption as well as the BCG assumption. But can I please give a couple of points from my own side? Beyond plain tabulation of COVID positive cases, their analysis or charting is quite meaningless for 3 reasons. One, increase in cases doesn't necessarily mean infection is spreading, because cases depend on testing. New cases of today could have been tested 3 days ago but weren't, in which case the rate would have dropped today and we'd have said the infection is decreasing. 2, death rate is defined as number of deaths by number of cases. So low case number means high death rate, and this creates panic. Right now we have 437 deaths and 13,387 positive cases. So our death rate is 3.2%, which is very high. 3, fitting country-specific data into the so-called Wuhan expat model published in the reputable Lancet, German scientists have determined the global detection rate, and they believe it to be on average 6%. In the case of Korea, it is 50%, but for India, it is only 1.68%. Even if you were to take it as 6% for us, we are detecting 16 times less COVID cases. This means we have a huge number of cases we aren't really picking. Silver lining, of course, is that our death rate then becomes 0.4% and not 3.2%. Thing is, this issue cannot be resolved by testing more through RT-PCR tests, because those are only tests we are doing. Some want them to be increased manyfold. Well, we have increased them manyfold in the past 3 weeks, from 3 per million population to 220 per million population. But here's the thing, of what we have tested, 302,950 samples, the positive cases are lowest percentage from amongst all nations that are testing in large quantities, 4%. In the US and Italy, it is 20%. This could either be because of, 1, as your models also suggest, differencing in sampling methodology, or 2, COVID hasn't yet gained a foothold in India even after 3 months, highly unlikely, or 3, Indians have a higher base level immunity because of BCG or exposure to environmental mycobacteria, or 4, Indians contracted COVID in large numbers but got cured without knowing they had contracted it, or 5, the lockdown came just at the right time. It is my view that the reasons might be 3, 4 and 5. In any case, more such testing might be useful, but not by much. What we really need, if I can have 1 more minute please, because this is important. What we really need from now on is antibody testing. Without the antibody test, we are traversing a tunnel blindfolded and frightened, because we simply do not know how many of us have already had COVID and got cured. Last week, for example, Germans conducted large-scale antibody tests on a town and found 15% population had contracted COVID and is now immune, or at least showed the presence of anti-COVID antibodies. RT-PCR tests showed only 2% had COVID. So in a single stroke, 1, 15% of the population can re-enter workforce. 2, those with symptoms or presence of viral RNA can be isolated, thus limiting viral spread. And 3, the death rate came down from 2% to 0.4%, quelling panic. Of course, since it takes some time for our body to generate the IgM antibodies, the kit cannot work in the initial week post-infection. But after that, the sensitivity shoots up, and so does specificity when the IgG antibody is also detected, and there is an overlap. RT-PCR testing success on the other hand.
On the panel, and Dr. Devi Shetty, he's the chairman of Narayana Institute, and Dr. Devi Shetty, you've looked at these models very, very closely. You've worked with the state of Karnataka. You've given them a study. I want to ask you, because these numbers are important on 2 counts. Count number one, of course, we need to know the spread in order to ready our health facilities. But count number two is also important, which is we need to plan our economic activity based on what kind of spread of this pandemic is going to be seen in India. And as Dr. Anand Ranganathan has said, is it that the numbers are really low at this point in time compared to the other states, or is it that many Indians have contracted this disease and probably become immune to it without ever having gone in for testing, because we have antibodies and immunities within us based on our climatic conditions, based on the fact that we have BCG vaccinations, and based on the fact that we are a TB malaria positive country, and therefore we have some amount of immunity against this virus.
See, my suggestion is that we should assume that the virus will behave exactly how it behaved in Italy, in England, and in US. I don't like to quote China because I'm not sure about the data. And we should also assume that the reaction of patients to the virus is exactly like how it was in Italy and US and England. By doing this, we will be prepared for the worst. And if the worst thing happens, like Indians immunologically more immune and a BCG protects us, summer heat protects us, if it happens, it's very, very good. But good thing in India is at least some states are at a very early stage of spread. Like a state of Karnataka, we haven't reached that level of very, very high number of COVID patients, not based on the number of tests we have done. We have friends running hospitals in different parts of the state, and we constantly interact. Right now, there aren't that many patients in the hospitals who are suffering from pneumonia and advanced complications. So all I'm trying to say is that if we can do tests, whether it's an antibody test or RT-PCR, it doesn't matter. Whatever tests you want to do, we should do it as soon as possible in as many numbers as possible. Because what is important now is to change our definition of a hotspot. Instead of saying one particular part of the city is hotspot, we should say that the house where the person is living is the hotspot, and track the family members and their primary and secondary contacts and try to isolate them or quarantine them or whatever is required. By doing this, I feel it will be more feasible because number hasn't reached huge epidemic proportion, at least in some of the states or most of the states. The Maharashtra and Delhi, I agree, because Delhi, you see large number, whatever reason it happened. So my suggestion is to assume that we still have a window of opportunities to do large number of tests and change the definition of a hotspot. See, how long we can go for a lockdown. Like lockdown was important when a patient from foreign countries came to India and spread the infection. Now we have enough patients in our own country to spread the infection. But we don't know who they are, and the patient themselves don't know they are the carriers. So that is one observation. But most important observation I have is our preparedness. We need to prepare when a patient develops serious complication of COVID, how we are going to manage. Fortunately, unlike in the Western countries, we have adequate number of beds, at least to manage the first phase of increase in the numbers in India. But these numbers of beds are not really yet ready for treating COVID patients. 30-bed, 50-bed hospitals will find it very difficult to manage COVID patients. We need to identify a hospital like medical college hospitals where there are large number of young residents who are very skilled and they are in large numbers, because you see, most of the private hospitals have only consultants. They don't have a junior level doctors who are trained to intubate, who are trained to manage ICU. Fortunately, our country is blessed with over 500 medical colleges, and they have a huge infrastructure. They have 500, 800,000 beds, and they are very well staffed, not because of the COVID, because of the medical council regulations. They also have a large nursing schools, paramedic schools. There are enough young people. COVID battle cannot be won by senior doctors. It can only be won by young doctors with skills, because doctors of my age, we are highly vulnerable.
But, you know, there are a few takeaways that we had put out, and these takeaways actually show us that number of cases of corona infection on May 22nd, if lockdown were extended by 3 more weeks, will peak at around 1,22,000 as an average of 6 projections. Rate of infections begins to taper if the lockdown is extended beyond May 3rd by about 19 days to May 22nd. Without lockdown, Health Ministry has estimated that the peak could even touch something like 8 lakh cases, you know, even by the end of April. So let me get in Sanjeev Sanyal. Sanjeev Sanyal, you know, it's so very important at one level to have preparedness at the health level, at the hospital level, number of beds, ICUs, but at another level, it's also important for economic activity. And a lot of businesses and a lot of unorganized sector, their well-being actually depends on how we phase out our lockdown and how we actually restart the economic activity. The give and take is between extending the lockdown from 3rd of May, which is currently seen as the exit date, to about 22nd of May. Do you think the economy can take on the burden and the costs that will come in with 19 days more after May 3rd of a lockdown, as our projections show, which is the ideal time to take off this lockdown?
First of all, I'm glad you're using a structured model, because it allows to a structure in the way we think about these issues. I'm not an epidemics expert, but I have spent a lifetime looking at nonlinear systems, complex systems, and financial markets, and urban systems, and so on. So I'm very familiar with the mathematics of it. So let me first say that such models are useful for scenario analysis. Please do not treat their projections as forecast. They are not forecast. These models are extremely susceptible to minor changes in initial assumptions, and so therefore it is very important to treat these models, especially when you're projecting out more than a month, with many teaspoons of salt. Now, the first thing you need to take into account, because you're dealing with an extremely uncertain situation, is that we need to react to real data rather than to projections. The projections have to be continuously updated, and we certainly need to use them for getting a sense of the scale and range of possible outcomes. But what we need is really keeping track of the actual data. So here, surveillance is important. Testing has been mentioned many times, and of course, testing is very, very important. The other important thing to realize is that this thing is not scattered randomly across the country. There are clearly hotspots. The dynamics of hotspots may be completely different from non-hotspot areas. So rather than think in terms of a generalized lockdown, which we had to do initially because at that stage we didn't have enough data and things were evolving very, very rapidly, we did a general lockdown. Presumably that lockdown also did retard a generalized spread of this disease. But now that we are getting much better, finer data from the testing, and of course surveillance of deaths and other things coming in from the hospitals, we can take a much more nuanced view of the matter. So I think we need to, rather than go into this debate with this, you know, it's better if we keep having a lockdown forever kind of approach, and have a much more nuanced approach about where are the hotspots, what are the trade-offs and risks we are taking. And by the way, we may also have to consider that we may discover a new hotspot and then have to respond to that. So I think a much more nuanced approach is what we need. As far as the economy is concerned, we have the same approach here. The lockdown was also a lockdown of the economy, but as we come out of it, we will have to begin to think of it in terms of the speed at which we undo this lockdown, and consequently what we do on the other side of it. And there are, of course, trade-offs at every stage. And our response, as you know, and I mentioned this yesterday, has also been one of step-by-step, rather than a big bang, big package in the beginning based on some projections. We have taken exactly the approach we are mentioning for the medical, which is that look at the real data, take a step-by-step, feedback-based approach and respond to this evolving situation. Do not try and base your response on one or the other forecast. Most of these forecasts did not forecast this problem.
Well,
they're not going to
that
be
makes
able to
a huge
forecast
lot of sense, considering India is a country as large as probably continents in some parts of the world, but also the climatic conditions, the habits of people, the kind of weather and climate changes that take place, and the immunity levels could vary from one part of India to the other, which is why when we come back after this short break, we look at, is there a climatic factor? Is there a regional factor? We'll give you the numbers that are predicted for states. Just as an academic study, we are not saying these are the real numbers, because as Sanjeev Sanyal points out, real numbers are going to be different because they are based on day-to-day developments. But this gives us a broad sense of how this pandemic is going across various parts of India. We look at those numbers, we look at the concentrated strategies that various states have deployed, and not a one-size-fits-all kind of approach which is dictated down from the center. All of that coming up after this very short break, when we'll also look at the 6 metros and the numbers there, and look at how we plan our lives going forward from here. Short break, back soon, don't go anywhere.
Stay home and get your car insurance online at
Welcome back, ladies and gentlemen, to this Big Times Fact India Outbreak Report. And we are calling this Fight Fear with Facts. And the facts that we presented to you is the overall scenario. And the peak that India is likely to hit is somewhere around the region of 76,000. We showed you that. Let's take a look at the state numbers. And the state numbers are right here given for us. Let's look at the southern states first, Karnataka, Kerala and Tamil Nadu. The peak numbers for these states have been fairly lower compared to the numbers that have been projected for some of the northern states. Let's take a look at these numbers that are coming up on our screen. And even as we speak, we are looking at some details that are coming in from various parts of the country. And these numbers are virtually holding true. Let's take a look at Karnataka, where on 3rd of May, the peak would be at around 847 cases. 14th of May, 925 cases. Kerala, May 3rd, 1,500 cases. And May 14th, about 1,567. In Uttar Pradesh, on May 3rd, there is 3,283 cases, but on May 14th, this is going to exponentially rise as per these projections to about 11,416 cases. Andhra Pradesh up from 1,214 cases on May 3rd to 1,323. Delhi from 5,878 cases on 3rd of May to about 14,283 cases, again an exponential growth. Tamil Nadu in control, 2,709 to 3,058. Telangana 1,300 to 1,450. Maharashtra 9,551 to about 16,219 cases. And that's how the states stack up. Let me get in Mr. Pandian. Mr. Pandian, Tamil Nadu has managed to contain the infection rate to quite an extent. To what do you think Tamil Nadu can really claim this as some sort of a fighting strategy for keeping these numbers low?
I think one is our Chief Minister deciding much earlier to go in for the lockdown, even before the central government announced. And I think in terms of taking care of the vulnerable, Tamil Nadu has always been a state which has done that well through Amma canteens and all that. I think migrant laborer, getting fed, getting sheltered without much of a hassle much earlier. Our focus has been, in fact, as much on containment as it has been on sheltering the underprivileged and the vulnerable. And in my view, if the statistical model, one, let me compliment Protivity and Times Now for doing this. It's given an excellent base to start with and benchmark our efforts against. And if you were to really add the recovery and death as another independent variable to this whole model, and it actually should continue as a dynamic model with everyday data refining this whole thing better for us. Like in Tamil Nadu, for instance, the last 3 days, we've had only 3% daily growth rate. Okay, now if you were to put that into this model, the projection would actually come to around 2,000 to 2,500 in the same window that you've spoken about. Some of it can aid the state governments to take decisions for 20th of April. What kind of industries to start up, what kind of controls do we put at that point in time. Right now, our entire focus is on that. How do we get back to normalcy so that the livelihood of people get restored a little faster without compromising on the other aspects which may spread the element here. Let me reiterate this. In Tamil Nadu,
you're absolutely right. There is a scientific way of doing this, and the scientific way of doing this, as Dr. Devi Shetty also advised, was to change the definition of hotspots. Right. So let me take that question to Mr. Satyendra Jain. He is the Health Minister of Delhi from the Aam Aadmi Party. And good evening, Dr. Satyendra Jain. Thank you for joining us. I want to take you through the numbers that are being looked at for Delhi. By May 3rd, the projection for Delhi shows around 5,000 COVID-infected patients. But this number rises exponentially by the 14th of May to about 14,000. Dr. Devi Shetty is also on the show, and his advice is that the entire definition of hotspots needs to be redefined. We can't call an area or a locality a hotspot. We should be actually be micromanaging this to the household level, houses where infections have taken place, keeping tabs on the movement of peoples in those houses. Do you think Delhi will need to adapt that kind of a very, very localized strategy in order to contain the numbers of COVID positive cases in the city?
नहीं, पहले तो आप एक दोबारा से रिपीट कर देंगे कितना नंबर प्रोजेक्ट कर रहे हैं ये लोग? What is the projected number?
प्रोजेक्ट कर रहे हैं कि मई 14 तक शायद 14,000 हो जाए, मई 3 तक 5,000 के करीब की बात कर रहे हैं.
5,000.
हाँ जी.
देखिएगा, दिल्ली के अंदर जो केसेज हैं उसके दो सबसे बड़े रीजन रहे हैं कि दिल्ली के अंदर सबसे पहले तो देश का सबसे बड़ा जो इन्फ्लक्स आया जो फॉरेन ट्रैवलर्स का, वो दिल्ली में आया. कई लाख लोगों को दिल्ली में एयरपोर्ट पे उतरे हैं. दूसरा जो मरकज़ मस्जिद वाला था जिसमें अभी तक 1080 लोग सिर्फ एक लोकलाइज्ड एक ही इंसिडेंस की वजह से पॉजिटिव आ चुके हैं. आउट ऑफ 1706 1080 मतलब 1080 जो लोग हैं, लगभग 70% बनता है, वो एक ही लोकलाइज्ड इंसिडेंस की वजह से है. और बाकी जो ग्रोथ आ रहा है, देखिएगा हमने प्रोजेक्ट किया था कि लगभग पूरे अप्रैल के महीने में शायद ये 12% चलना चाहिए और 12% से थोड़ा कम चल रहा है. अगर हम निजामुद्दीन को अलग कर दें, अगर निजामुद्दीन को ऐड कर लेते हैं तो फिर 12% से बहुत ज़्यादा है और उसको अगर ग्राफ में डालेंगे तो लगता है कि बहुत ही ज़्यादा नंबर होगा. मुझे लगता है कि शायद जो आपने फिगर्स बताई हैं 14,000 और 5,000, भगवान से मैं कहूँगा कि इतना ना पहुँचे, पर अगर पहुँचता है तो हमने तैयारी तो उसकी की है. हमने 30,000 अगर हमारे पास पेशेंट होंगे तब तक की तैयारी हमने फर्म तैयारी की हुई है. और जहाँ तक लोकल आपने बात बताई है, हम दिल्ली के अंदर जहाँ पर भी 3 भी केस आते हैं तो उसको लोकलाइज, उसको सील करके उसको लोकलाइज, उसको कंटेन करने की कोशिश कर रहे हैं. और बिल्कुल आपकी बात सही है, एक भी केस आता है तो उसकी फैमिली में, उसके जानकार लोगों में उसमें बढ़ने के बहुत चांसेस रहते हैं. तो उसको हम एक एक केस को ढूंढ रहे हैं और उसको कंटेन करने की कोशिश कर रहे हैं.
बट आपने कहा 30,000 केसेस तक हम प्रिपेयर्ड हैं टू टेक ऑन. मैं समझ रही हूँ बात, लेकिन अगर मई 3 और मई 14 के बीच में इतनी बढ़ोतरी होती है नंबर्स की, तो क्या आपको लगता है लॉकडाउन एक्सटेंड करना एक ऑल्टरनेटिव है जिसको हमें एक्सप्लोर करना पड़ेगा, कम से कम दिल्ली जैसे शहर के लिए?
देखिएगा, मैं इतना तो बता सकता हूँ, जो पिछले 3 हफ्ते का या 22-23 दिन का जो लॉकडाउन है, अगर ये लॉकडाउन नहीं होता, जो डिफरेंट मॉडल्स हैं वो सब बताते हैं कि कम से कम 50 गुना केसेस होते हैं. तो लॉकडाउन का बेनिफिट रहा है, ये तो मान के चलना पड़ेगा. और अगले 2 हफ्ते में अगर सीरियसली और सिंसियरली सभी लोग कर लेते हैं तो मुझे लगता है दिल्ली के अंदर काफ़ी हद तक कंटेनमेंट रहेगा. और लॉकडाउन जब भी हटेगा एकदम से तो लिफ्ट नहीं होगा सारा, कुछ चीज़ें रहेंगी, कुछ हटेंगी. तो मुझे नहीं लगता कि 3 तारीख को बिल्कुल ही जैसे फ्री फॉर ऑल होने वाला है. 3 तारीख के बाद भी कुछ चीज़ें सर्विस, जैसे 20 अप्रैल को कुछ चीज़ें बढ़ रही हैं, तो उसी तरह से 3 मई को भी कुछ चीज़ें बढ़ेंगी. 100% नहीं खुलेगा, मुझे नहीं लगता है.
All right, so that's a cautious policy. Thank you, Dr. Satyendra Jain, for joining us. A cautious policy is what many cities and states will have to follow. And Dr. Ashok Seth, he's the managing director of Fortis Hospital Group, and also Dr. Bagai. I want to come to both of you first. A graded exit plan is probably the way to go, and most states, most cities are believing that's the way to go. I want to ask you, Dr. Ashok Seth, how are those cities, especially like Delhi and Mumbai, who have a higher rate? And before I come to you, let me unveil the number for these cities. Chennai on May 3rd will have a peak of 229. On May 14th, it will be 259. So that's only 30 cases extra in the 11 days. Mumbai, 4,014 on May 13 and 5,816 on May 14. Bengaluru, 167 to 204. Hyderabad, 309 to about 407. And Delhi numbers we've already put out for you. So, Dr. Ashok Seth, I want to ask you, Mumbai, Delhi are the 2 cities where there will be a lot of economic activity, but these are also the cities that have probably cases which are on the higher side in the country. How will these places have to deal with their lockdown strategy as well as economic activity, restart, reboot activities?
So let me just come in by saying that, firstly, of course, your mathematical model is great. I think we compliment you for that. It actually provides us a good guidance about policies and perhaps what to expect, maybe. But sometimes it leaves us half knowledgeable as well. And that's primarily because it does not factor in many of the issues which actually it relies on assumption. The good fact is that it actually takes into account what's happened over the last 3 weeks of the lockdown. And therefore, that's true Indian data on which this mathematical model is being built. But let me also say that the variables are hopefully around the corner for us. And as we say that, what we're talking about is the fact that it doesn't take into account whether temperature variations would do anything, whether compliance to the lockdown would actually change any issues, whether there are other factors which are influencing this. And I think, therefore, what we really need to do is watch it weekly. While we can't plan economics on a weekly basis, but we can certainly strategize around the lockdown as we see how the mathematical model fits in with reality over next week. And certainly our policies need to change week by week as we see the reality in front of our eyes. Having said that, I must also tell you one more thing, and this for Delhi and maybe for Mumbai. Mumbai, clearly, more testing is being done, more cases are being uncovered, and hopefully stricter issues and norms are being put into place. And that's another thing which changes the mathematical model over a period of time. For Delhi, some of these numbers which are projected could also be as a result of the Nizamuddin cluster creating a huge rise in the last few days. And yet again, we see in the last couple of days plateauing out. Having said that, I must also emphasize the very important thought processes which come to mind. That as we actually see these guidance and compliances coming in, we've got to be very clear about one fact which I keep asking, and we are now into 6 weeks from the Italian group which caught this virus, the international travelers who came here, and I think more than 2 months away from the first case in Kerala. When I speak to my colleagues in the United States and England, they at this time are overpowered with serious COVID cases, and I'm not talking about cough and sore throats. Their ICUs are full, they just don't know where to put these patients. There are patients on the ventilator. And the good part at the moment is that India, the situation is still manageable. Now we can say that's part of the lockdown itself. And I totally compliment the lockdown and believe that that's a major part of why we're seeing lesser cases. But truly, when I speak to my colleagues in the tier 2 cities, we're not seeing the serious cases on ventilators. The last projection was that there were no more than 40 cases on ventilator perhaps in the country, which is so different 6 weeks later to what it is in the West. So maybe that there is something else which is working. We can't rely on it. We can't put our hand on it, but we actually have to hope that there are other factors working in our favor. We still have to be not complacent about it. We have to work on this mathematical model.
Is the entire fight now down to a hope and a prayer? Because really, we are not getting any news of a vaccine coming up soon. There are divided views on the use of hydroxychloroquine. Also, many people are now looking at the plasma therapy and whether that could be the answer. The issue really here is, how do we plan through these mathematical projections for the future? Delhi still showing, possibility of an exponential growth. Uttar Pradesh showing the possibility of an exponential growth. How are the different states behaving? And, if you look at down south, Kerala has made a turnaround much faster. Are there any studies? Because Hyderabad, Tamil Nadu, Kerala, Andhra Pradesh have all managed to, keep a lid on the growth of cases. Is there a north-south divide in the behavior? Are there any reasons for this? Or is there a common model that can be adopted across the country?
So there is clearly no common model. And that's why I think your mathematical model is very important. You've got to be prepared for the worst. And that model perhaps clarifies the worst of the situation, and we're hoping for better situations than that. So we've got to actually be prepared. It's almost an eerie feeling, to tell you frankly, despite what I was saying, as we hear what is from the West, it's almost like we've shuttered our windows. We're actually in the path of a hurricane, and we're just waiting for the hurricane around the corner. And every day we're praying that it doesn't come. Let's hope that happens.
Well, we're hoping to keep the hurricane away. But Dr. Bagai, what are your thoughts on this?
Hi, Navika. Very quickly, I think most of the Western systems, as far as the medical fraternity is concerned, it's been a medical carnage. They've been overwhelmed. I agree with Dr. Seth. I have a lot of my friends and colleagues there. They've never seen this kind of a tornado which has swept away patients right in front of their eyes. Never in their life have they seen it. Never have in our lives have we read about it in this manner. But with regards the projections and these numbers and the study, I'll tell you why I'm very confident that this lockdown is working and it will sustain to work. At the present moment, we are seeing a case fatality or a RO of just over 3. I think this number is high because your denominator for your division is low. I must add that we are relying only on the PCR test, which has a maximum sensitivity nearing 67 to 70% only. And that also depends upon the timing of the day of the test in your illness. Now, we have not included the ELISA test in our analysis, and that's why your denominator is getting skewed, and therefore your death rate, which is being projected, is still high. If you include that, your overall sensitivity reaches 88 to 90%. That's part one. Part two is, I think, with regards to the lockdown, when we are going to exit, it's graded on 20th and then graded on 3rd of next month. It's a 80-20 formula. I think it's a fine balance between what we have achieved medically, what we have achieved in terms of saving thousands of lives, and what we are losing out economically. Now, to gain that extra 20%, we should not lose out 80% overall on the economy, because poverty and hunger are the two greatest diseases, at least in the Indian subcontinent. The last point which I want to make is, just in sheer comparison, we unfortunately have lost, every human life is valuable, about 430 to 440 Indian lives. Compared to US, more than 35 to 36,000, considering just 2 points in comparison. As far as the population is concerned in terms of numbers and the population density, if you factor that as a simple ratio, if our lockdown was not here, our numbers of case fatality would have been in many hundred thousands. I don't even want to quote the figure because there is no point in creating anxiety. I think our social behavior is going to decide our next 2 months, 3 months panning out of this disease. We have to allow this to burn out. Corona is here to stay for a few months, maybe a couple of years. But we have to allow to pan out. I know that there are research happening right now for innate immunity, ambient temperature, BCGs, but those are still under study. So I don't want to pin any projection on hope, which is just random assumptions. At the present moment, it's working. We need to stay united. We need to follow the government guidelines, get our infrastructure ready, which already is. And
hope for the best. So let me also get in Mr. Reddy, who's the Industries Minister of Andhra Pradesh. And Mr. Reddy, I want to ask you this. There is a price to be paid for the economic lockdown. With the Andhra experience, do you think the economic activity coming back by 3rd of May is something you'll be hoping for, given that Andhra Pradesh has managed to keep its numbers down and therefore could experiment a bit? Or would you err on the side of caution, like Dr. Bagai says, that it's an 80-20 situation? To gain the 20% through the economic activity, can we risk the 80% gains that we've made through the lockdown?
Good evening, Navika. I just want to start off by saying, I think as you rightly pointed out, the RO tests, the RO, that is the empirical formula that is done for basically the reproduction numbers that is there, basically from how many secondary infections can come from one primary infection. That is one notable aspect one should actually look into before any decisions are being made. If you want to, as we said, there is also an exit strategy being planned out. But for this exit strategy, first and foremost is this RO number that we're looking at. Are we standing, where are we standing? We're standing, within Andhra Pradesh, we're standing well below 1. But we have to look at it as a countrywide kind of a phenomenon. because this does not, it does not mean that if I contain one area and I leave rest of the area free, it's going to be, it's not that the disease is not going to carry around. We know very well the history. I mean, this disease has very contagious, and the way it has been behaving, that it has gone and crossed, it has gone trans borders, it has gone into families, it has gone into communities where there have not been primary exposures, not many primary exposures. So having all this data on hand, I think any policy maker will first look at the RO model first, and then he will also understand that if I have to be prepared for a releasing of this lockdown, in a structured way, we also need to be prepared in terms of primary testings, primary screenings. Now, today, in the state of Andhra Pradesh, we've been having this low number primarily because, our screening system, although we did not have the devices to do it, we had a robust, village secretariat and a volunteer system who were keeping tabs on people who returned from within the country and who returned from outside the country, who were quarantined, and they were, sort of like monitored. Now, if you see, this is how we had done in the initial outset of this diseases that had come in. But as we know today, one notable aspect is that, recently, one of the first ingenious PCR test kit was inaugurated in the state of Andhra Pradesh from the MedTech zone. So now we have access to such more testing kits. For example, today our frequency of tests has gone up from a low number of hundreds to we are standing around 4,000 per day today, what we're standing. And we want to increase this number to much higher than more than 20,000 per day. We've ordered something like 50,000 kits from this PCR test kits that is coming out of this MedTech zone. And apart from it, we've also gotten this, it's a mix of, the antibodies test.
So clearly, every state is learning on the way. This is a pandemic that has no previous history. It's something of a crisis that every country is dealing through their own models that they've built. Our exercise at Times Fact, India Outbreak Report, has been to try and find some number modeling based on average rates, going by international studies and 3 different methodologies, and through this come to some sort of a number which gives us a look into the next 3 or 4 weeks on how we need to plan our health strategy at the policy making level and our business strategy based on the length of the lockdown that is required. We've attempted to do that. It's not going to be 100% accurate science, but this attempt is only to point out one fact, that India is geared up to take the challenge. The numbers are not anywhere close to the numbers we've seen in some of the other countries like the United States of America, countries like Italy, Spain, or even China, whatever their numbers may be. But the fact of the matter is, while we prepare for a worst-case scenario, we need to plan our strategies for a best-case scenario and life after COVID-19. And that's exactly what our attempt has been, because there's only one way to fight this. Fight fear with fact, because just being fearful about a pandemic we know nothing about is not going to help us. We have to fight our fear with facts. Thank you very much, ladies and gentlemen, for joining me on this big broadcast. We hope it's had some value in planning your future over the next 4 to 6 weeks. Thank you.
जीतेगा भाई जीतेगा, खेल खेल में जीतेगा, घर बैठे वो जीतेगा, इंडिया जीतेगा, Nazara.com पे जीतेगा।
जब सब घर बैठे खेलेंगे Nazara.com पे क्रिकेट कैरम क्विज, तो इंडिया जीतेगा ही ना।
खुश है
1, 2, 3, 4, 5.
Top of the world with Times Network. And you're watching Mirror Now.
India records over 13,000 cases of coronavirus and 452 deaths. Over 1,076 cases and 32 deaths recorded in the last 24 hours alone. 230 patients cured in the last 24 hours and discharged from hospitals. The Health Ministry takes a firm stand on the quality of testing kits, says that if the quality of the rapid testing kits are found lower than the defined quality, the government will not use it. The government reiterates its plans for setting up dedicated COVID hospitals, also aims at making 10 lakh test kits